Hello, friends. Welcome to today's program. You are welcome to my page, Managing Diabetics and Living with Diabetics. I hope you guys are doing well. Okay, I just want to let me pop in and then just make a broadcast, do a topic for today. Okay, and then I hope you guys are doing okay. All right. Let me just make this clear. If you guys are hearing any noise, a background noise, just ignore it. It's my AC. The AC is on, so that is why you're going to be hearing a background noise. Just ignore it and concentrate on the topic. All right. If you've not subscribed to my page, please kindly do so. All right. Kindly do so if you've not subscribed to my page. And do not forget to share and leave a comment for me. Today, I'm going to be discussing about low blood pressure. I will be discussing about low blood pressure. That is what I'm going to be discussing about. Okay, so if you want to get a pen and paper, kindly do so. All right. If you want to get a pen and paper, kindly do so. All right. Okay. Now, as I said, today is going to be, I'm going to be discussing about low blood pressure. But before I do that, I would like um, to answer some questions. I would like to answer some questions. All right. I got a couple of questions that I need to answer, and then I can proceed with what I'm going to be discussing today. Because I have some messages that I received. Let me look at my computer and my page and answer some questions. I got some messages, and let me just go through some of the questions. Mike asked me a questions. He says, "What are the main causes of diabetes?" Okay, Mike asked me a question and says, "What are the main causes of diabetes?" Uh, the exact cause of any kind of diabetes, either type 1 diabetes or type 2 diabetes, is unknown. But basically, there are two notable reasons why you are a diabetic. But the exact cause or a direct cause that causes diabetes, any type of diabetes, either type 1 diabetes or type 2 diabetes, is exactly unknown. But there are two related causes of diabetes that is being publicized in general, that is in the public domain, that what causes diabetes. Okay? In all causes, sugar build up in the bloodstream. There's too much sugar in your bloodstream, that is what is in the public domain that everybody understands that causes diabetes. So when there are too many sugar in your bloodstream, the elevation is too much above the normal level of diabetics. Above the normal level of sugar that you're supposed to have in your system, that triggers you to be diabetic. Okay? So too much sugar in your bloodstream can lead you to be diabetic. That is one. All right. Now, this is because the pancreas does not produce enough insulin to regulate that excess sugar that is in your bloodstream by removing them, and then you pass them out through your urine or absorb them into your cells and into your liver to be stored. So When your pancreas cannot produce enough insulin to be used to regulate the sugar level, then you have too much sugar in your bloodstream that triggers the higher elevation of sugar level in your bloodstream that makes you to be diabetics. Okay? Or your pancreas is producing more than enough insulin that your body, more than what your body required to regulate the sugar level in your bloodstream, but your body doesn't know how to use the excess insulin that your body produces to regulate the sugar level. So now you are having a situation whereby you are a diabetic. Okay, so that is what causes diabetics. All right, and the other issue is the issue of hereditary. If you have in your lineage of your family, maybe somebody, either your father or from your mom's side or from your dad's side, is diabetics. So once you have it in your family, then there is the tendency that you might be diabetic. You might cut it, or you might escape it, and then one of your child or your grandson become diabetic. So that this is what causes diabetes. All right, Mike. I hope I've answered your question. Now let me go to the second questions. This one says, "What are the warning signs of diabetes?" All right. What are the warning signs of diabetes? Okay. Let me show you guys something. I'm drinking today. I'm drinking today a cinnamon tea and a chamomile tea. Cinnamon tea and a chamomile tea mixed together. This is what I'm drinking just now. All right. So, what are the warning signs of diabetes? One, the notable signs that which is the symptoms of diabetes, the one that you can notice. Remember, some diabetes you might not notice the symptoms. You might be diabetic for 6 months up to a year, and you don't even know that you are diabetic because some of the symptoms are silent. But there are some symptoms that are noticeable, and the one that are noticeable is the frequent urination, that you are rushing to the toilet every second to urinate. That is one symptom or signs of diabetes. When you are visiting the washroom every second, when you are peeing every second, even by the time you get to the washroom, you already pee in your pants. That is one sign of diabetes. And then when you are having a blur vision, okay, when you are having a blur vision that you cannot see clearly, objects appear to you in double vision, okay, then that is another symptom that you are diabetic. All right. Tiredness, okay, you are feeling so tiredness, fatigue, loss of energy. That is a symptoms of or warning sign of diabetics. Or you have blisters or cut or wounds that cannot heal properly in time. It takes a longer period of time to get healed up. If you're cut, any wound you have in your body is not healing properly and in time, it takes weeks and months to get healed, then know that there's a possibility that you are a diabetic. Okay, so those are some of the signs or warning signs of diabetics. And then thirsty. Okay, thirsty. You are drinking a lot of water. Okay, these are some of the signs of diabetics. Okay, now the next question before I go into my topic today. Somebody asked me, can diabetes be cured? No, diabetes cannot be cured. Diabetes can never be cured, but it can be managed. It can be treated. It is one ailment that has no cure, but it can be treated and it can be managed. Once you treat it, then you have to live with it to manage it properly, but it cannot be cured. That's one fact that you understand. There's only one possibility that you can reverse it back when it is on the borderline. We call it pre-diabetics. If you catch it in time, once it's on the borderline, you stand the chance of reversing it back. Okay, that is one possibility. You can reverse it back. Okay, but once it crosses that borderline, it cannot be cured anymore. You have to live with it for the rest of your life and manage it. All right. And the next question is too many questions here, but I'm going to take one more. How somebody asked me how to reduce diabetes. Okay. How to reduce diabetes is to eat healthy plant food. Okay, you got to eat a balanced diet, healthy food that are rich in fiber, less carbohydrate. Okay, you got to change your dieting and eat healthy, less carbohydrate, more fiber. Learn how to count your cows, and then you have to also join in with exercise. You have to be active. You have to be exercising all the time in conjunction with your medication. Then you'll be able to reduce your diabetes and bring down your sugar level to normal. All right. Okay. So let me go. I'm going to just leave these questions now and then go into the topic that I'll be discussing today. My topic today is what is low blood pressure? Okay. What is low blood pressure? Another word for low blood pressure is hypertension. This is hypotension. That is hypo, HYPO, hypotension. When your blood pressure is too high, we call it hypertension. So this is hypotension when your sugar level when your blood pressure is low. When your blood pressure is high, it's called hypertension. And when your blood pressure is low, it's called hypotension. That is another word for it. So you have to differentiate between hyper and hypo. So what is low blood pressure? Okay. Hypertension or low blood pressure is when your blood pressure is much lower than expected. Okay. It's when your blood pressure is below 90 stroke 60 millimeter per of mercury. Okay. Low blood pressure is, or hypertension is, when your blood pressure is much lower than expected. That is below 90 stroke 60 millimeter of mercury, which is mm stroke Hg. Okay, that is when you are referred as having a low blood pressure. Okay, it can happen either as a condition on its own or a symptom of a wide range of conditions. So when you have a low blood pressure, it can happen on its own, or it could depict a wide range of condition, underlying condition that you have to find out why am I having low blood pressure. Okay, it may not cause symptoms. Normally, some low blood pressure you might not experience any symptoms, but when it does, you may need a medical attention. All right, when it does, you may need a medical attention. Okay. And then we have two type of uh, low blood pressure. Okay, there are two type of low blood pressure. We have the absolute low blood pressure. We have absolute low blood pressure. Okay, when your blood pressure is below 90 stroke 60 millimeter of mercury. Okay, that is absolute low blood pressure. And then we have orthostatic hypotension. Orthostatic low blood pressure is when your blood pressure stay low for a longer than 3 minutes. Okay, orthostatic low blood pressure is when your blood pressure stays low longer than 3 minutes after you stand up from a sitting position. All right, when you stand up from a sitting position and still yet your low blood pressure remains more than 3 minutes, you have orthostatic low blood pressure. Okay, it's normal of your body of your blood pressure to drop briefly when you change positions. Okay, when you are engaged in physical activities, your blood pressures might change. Will change when you are physically in the gym. Your blood pressure will change. So anytime you change positions, your blood pressure is changing. When you change positions and your blood pressure remains longer than 3 minutes without going back to normal, then you have what's called orthostatic uh, low blood pressure. Okay. This guy is asking me a question. Okay, I'm going to ignore this question now and let me continue what I'm saying. And then, so when your blood pressure remains longer than 3 minutes after you stand up from your sitting position, it's called orthostatic low blood pressure. Okay, because that occurs normally when you change positions. The drop must be 20 millimeter of mercury or more for your systolic, which is the top pressure, and then 10 millimeter of mercury, which is your diastolic, which is your bottom pressure. Okay, so it's going to be 20 stroke 10. The drop must be 20 millimeter of mercury, which is the systolic, which is the top pressure, and 10 millimeter of mercury of diastolic, which is the bottom pressure. Another name for this is called postural hypotension. Okay, if you don't want to use orthostatic pressure, you can use what is called postural low blood pressure because it happens when you change positions. Okay, from the sitting positions you are standing, your blood pressure is going to change. From a standing position to a sitting position, your blood pressure is going to change. When you are running, okay, when you are walking faster, your blood pressure changes depending on the position and the activities you engage. That is why it's sometimes called postural hypertension or orthostatic low blood pressure. Okay, so now measuring your blood pressure involves two numbers. You need your systolic, which is the top number, and your diastolic, which is the bottom number. All right. So, and if it is below 90 stroke 60 millimeter of mercury, then you have a low blood pressure. Okay. So these are the only two ways you can measure low blood pressure. Your systolic, which is the top number, and your diastolic, which is the bottom number. Okay, your systolic is the pressure of your arteries each time your heart beats. So each time your heart beats, each time it measures the pressure of your arteries. Remember, the blood passes through the arteries, so it measures the pressures in your artery each time your heart beats. That is systolic. Now, diastolic measures the pressure of your arteries when they are under between the heartbeats. Okay, when they are under between the heartbeat. All right. So if you understand the two differences, the systolic and the diastolic, then you'll be able to differentiate what measures what and what measures this. So remember, the systolic measures the top bottom number, the top, and the diastolic measures the bottom number. Now, what is considered, or when can it be considered that you have a low blood pressure? And I said earlier on, if your low blood pressure is below 90 stroke 60 millimeter of mercury, okay, then you have a low blood pressure. Normal blood pressure is above that number, which is about 120 stroke 80 millimeter of mercury. Okay, so that is when you have a number that is below 90 stroke 60 millimeter of mercury, then you're experiencing a low blood pressure. A normal blood pressure is 120 stroke 80 millimeter of mercury. Okay, now how common is low blood pressure? How common is low blood pressure? Because low blood pressure, okay, is common without any symptoms. I've said it several times. It is common without any symptoms. Low blood pressure, it is common without any symptoms. Sorry, I'm changing my. Let me adjust my computer. Right? Okay. So, how common is low blood pressure? Low blood pressure is common without any symptoms. It is impossible to know how many people it affects. All right. However, the postural hypertension seems to be more and more common as you get older. As you get older, then you might experience the postural hypertension. That is one that is more common. And estimated about 5 to 10% of people in that age bracket of 50 and above fall into that category. Okay. Now, who does low blood pressure affect? Who does low blood pressure affect? Okay, low blood pressure can affect anyone, any age and background. It does not discriminate. It can happen to anybody. Everything depends on your health wise, how you keep your body. All right, what you eat. Are you active? So it can happen to any age, any person, irrespective of your background. Okay? However, it is more likely to cause symptoms in people over 50. When you over 50, then you are in that range of experiencing one or two type of hypertension. Okay? So people that are above 50 tend to be more prone to experience one of those two type of hypertension. Okay? I mean hypertension. However, it is more likely to cause symptoms in people over 50. All right? So people who are very physical active, which is more common in younger people. Now, let's talk about the symptoms of low blood pressure. Can we talk about the symptoms of low blood pressure? What are the symptoms of low blood pressure? Dizziness or feeling lightheadedness. When you experience, you're feeling dizziness or feeling lightheadedness. 2, fainting or passing out unexpectedly. All of a sudden, you faint or pass out. Number 3, nausea or vomiting. Number 4, you have a blurred vision or your vision is distorted. You cannot see clearly. Number 5, shallow breathing. When you are losing breath, when you are losing a breath, either your breath is fast or it's shallow. I've said it several times in one of my videos. Anytime you are losing your breath, shortness of breath, you have to go and see a doctor to make sure, because it means your oxygen is dropping and you don't want it to affect your brain, cause a very serious damage in your brain, because oxygen passes through it's been transported. Oxygen is being transported to your brain through the blood. Okay. Now, number 6 is fatigue or weakness. Number 7 is feeling tired, sluggish, or you are feeling lethargic. All right. Number 7, confusion or trouble concentrating, lack of concentration, okay, or you become disoriented and confused. And number 8 is agitation, unusual changes in your behavior. These are some of the symptoms of low blood pressure. Okay, and I'm going to show you guys a diagram now. Let's go to this so that you guys know. Just a minute. I'm going to show you guys something here. Okay. All right, let me show you guys a diagram I created. Okay. I'm going to show you guys something here I created. Okay. All right. So this. All right. This. Some of the symptoms of low blood pressure. Okay. So you have dizziness or lightheadedness. You have fainting or passing out. You have upset stomach. You have blurred or distorted vision. You have fast or shallow breathing, and you have fatigue or weakness. You have feeling tired, confusion, and agitation. Okay, these are the symptoms of low blood pressure. Okay, this is the symptom of low blood pressure. Now, for people with symptoms, the effect depends on why your low blood pressure is happening, how fast it develops, and what causes it. All right. Once you start experiencing low blood pressure, you have to find out why do you have low blood pressure. It is very important to find out why are you experiencing low blood pressure. Okay, slow or decrease in blood pressure happen normally. So hypertension becomes more common as people get older. Fast decreases in blood pressure can mean that certain parts of your body aren't getting enough blood flow. All right, that can have effects that are unpleasant, disruptive, and even dangerous to your health. Okay, so now once you are experiencing low blood pressure, okay, I will recommend you go and see your doctor. Seeing your doctor is very, very important. Seeing your doctor is very, very important. To go and see your doctor anytime you are experiencing low blood pressure. So, what are the possible signs of low blood pressure? Okay, a heart rate that is too slow or too fast. When your heart rate changes, is beating too slow or too fast. A skin color that looks lighter than it usually does. When your skin color changes and becomes lighter, okay, and then your knee calves are cool, okay, you have a low cardiac output, how much blood your heart pumps out, and then your low urine output. So when you have these signs, this experience of any of this, then know that you are having a low blood pressure. Now, what causes a low blood pressure? Okay, as I said, low blood pressure can happen irrespective of your age, your background, it doesn't care whether you are young, child, or older. It depends on your health, how you take care of yourself. If you take good care of yourself in terms of your dieting, eating well, exercising, then you stand the chance of avoiding low blood pressure. So low blood pressure can happen for a wide range of reasons. There are different reasons why you might experience low blood pressure. There are different reasons why you experience low blood pressure. Okay, the postural low blood pressure. This happens when you stand up too quickly, and your body can compensate with the blood flow to your brain. For instance, I'm talking about the postural low blood pressure. It's when you stand up too quickly. Remember, it is when you change your positions. Anytime you're changing your positions, your blood pressure changes. So if you stand up too quickly, and if your blood pressure cannot compensate or balance normal to take blood to your brain, then it can make you to have low blood pressure. The second one is when you have a nervous breakdown, central nervous system disease. Okay, if you have like something like Parkinson disease, okay, Parkinson disease can affect your nervous system controls, because your nervous system controls your blood pressure. So people with this condition may feel that the effect of low blood pressure. So once you have central nervous disease like Parkinson disease, it's going to affect your low blood. It's going to affect your blood pressure to deepen to an extent of going to low blood pressure. Okay, low blood volume. Okay, blood loss from severe injuries. When you have a severe cut, that is why when you have a severe cut, okay, you are in an accident or you have a severe cut, you're advised to close that wound. Take something to hold to tighten that area so that your blood will not be flowing out so easily. Because the more you lose blood, the more your blood pressure drops. So low blood volume, especially when you have a severe injuries, can cause low blood pressure. Okay, dehydration also can contribute to low blood pressure. That is why don't allow yourself to be dehydrated. Drink a lot of water. Okay, because if you are not drinking a lot of water and you get dehydrated, that can also affect your blood pressure to deepen for you to have a low blood pressure. And then having a life-threatening condition. Okay, this condition include irregular heart rhythm. Okay, um, for instance, if you have any immune reaction, immune disease, okay, or a collapsed lungs, that's what we call life-threatening condition. Can also affect your blood pressure to either go to be for you to have low blood pressure. Okay, heart and lung condition can also cause you to have low blood pressure. You can get hypertension when your heart beats too quickly or too slowly. Okay, that can cause you to have low blood pressure. Prescription medications also, type of medication you take can also make you to have low blood pressure. Okay, so once you know that the medication you take can cause you to have low blood pressure, then your doctor might decide to change the medication. Taking alcohol also can contribute to you to have low blood pressure. Okay, when you are taking alcohol, it can affect your medication at the same time cause you to have low blood pressure. That is why doctors advise you to limit your alcohol intake or stop drinking alcohol, because the variation in terms of your medications, it can affect it. Okay, pregnancy can also affect your blood pressure. Okay, to cause you to have low blood pressure, especially when you are bleeding, or other complications of pregnancy can also, when you have complication in your pregnancy during the time of childbearing, can make you to have low blood pressure. And extreme temperature, these are some of the causes of low blood pressure. Okay, then what are the complications of low blood pressure? What are the complications of low blood pressure? All right, so I'm going to make this quick. Okay, I'm going to make this quick, and then maybe I'm going to continue. I just rushed out of the clinic to do this video. All right, so I'm going to make it quick because my break is, I have to go back to the office and then attend to some people. So what are the complications of low blood pressure? Complications that can happen because of low blood include falls and fall-related injuries. Okay, what are the complications of low blood pressure? Falls and fall-related injuries. If you have low blood pressure, it can cause you to fall or have fall-related injuries. When you fall, you might have you might have a fracture, or you might have a busted head, a busted skin that blood will be rushing out. So anytime there are some falls or fall-related injuries that can contribute, because you are losing a lot of blood, can make you to have low blood pressure. Shock. Okay, when your blood pressure is low, that can affect your organs by reducing the amount of blood they get. Okay, that is why it is very, very important. Don't allow your blood to dip so low so that you don't go into shock. Okay, so that can cause organ damage or even shock. All right, the same thing applies to your sugar level. Don't allow your sugar level to go below so low, because that can send you into shock and cause a lot of damages to your organs. Okay, heart problem or stroke. You can develop a heart problem or stroke because of the complications of low blood pressure. Low blood pressure can cause your heart to try to compensate by pumping faster or harder. Over time, that can cause permanent heart damage and even heart failure. When you are overworking your heart, because the arteries are clogged, okay, the lipids in your arteries have clogged your arteries, so your heart is now working extra hours, working 2 times the normal rate to pump blood from the heart to the brain. Okay, that can cause a damage to the heart or even heart failure. Okay, so let's see how blood pressure is diagnosed. Okay, let me squeeze in this. How is blood pressure diagnosed? Okay, hypertension itself is easy to diagnose. Taking your blood pressure is all you need to do. Okay, these days, if you go into the shop, there are things you can buy from the shop to measure your low blood pressure from home. Okay, so it is very easy to diagnose at home, or when you visit a clinic or hospital and they check your blood pressure. Okay, but figuring out why you have hypertension is another story. So if you have consistent low blood pressure, okay, it is consistent, then that's a different story. There might be an underlying illness or condition that need to be checked out. So it varies. It is wide. So anytime you're having a low blood pressure that lasted more than a week, 2 weeks, then it becomes a different story. So if you have symptoms, a healthcare provider will likely use a variety of tests to figure out why you are having a low blood pressure. Okay, so what are the tests to be done to diagnose low blood pressure is lab testing. test on your blood and pee. That is, test on your blood and urine can look for any potential problem like diabetics, vitamin deficiency, thyroid or hormone problem, low iron levels, that is, and they don't, try to avoid anemia, pregnancy. Okay, so through lab testing, that is testing your blood and urine, they'll try to find out if you're diabetic. That is one thing. If you have vitamin deficiency that is contributing for you to have a low blood pressure, if you have any thyroid or hormone issues, okay, if your thyroid glands are functioning properly, or are you having an underreactive or overreactive thyroid? Low iron levels, because when you have low iron levels, that can cause you to be anemic, and try to be anemic. Try as much as you can to avoid being anemic because of the excruciating pain that people that are anemic go through. Okay, then pregnancy. Anyone who can become pregnant, these are some of the way the testing you can do, lab testing. Then the imaging, you can also do imaging tests to find out if provider suspected a heart or lung problem. Maybe the doctor suspect, for instance, if your blood work comes back, it is not conclusive. They cannot pinpoint why you are having a low blood pressure through your lab testing, through your blood or urine test. Then they can escalate it to an imaging test, your CT scan or MRI test, to check if they suspect maybe you are having a heart or lung problem that is behind your low blood pressure. Then they'll send you for an imaging CT scan or MRI test to check your heart and check your lungs. Okay, to see if they are right. So X-ray, okay, a computed like I said, CT scan, MRI, or they can do something like ultrasound. Okay, to check your lungs and then your heart. Okay, so another way they can test for a low blood pressure is through diagnostic testing. These tests look for a specific problem with your heart or other body system, like we have the ECG. Okay, ECG or EKG, depending on the country you are. Some use EKG, some use ECG, which is the electrocardiogram. Okay, exercise stress testing or teeth tablet test. So they can use those testing to figure out why you are having a low blood pressure. Okay. Now, how is low blood pressure treated? Okay. How is low blood pressure is treated? Low blood pressure is treated usually start with finding out why it is happening. First of all, you have to find out the underlying causes of your low blood pressure. After a series of tests, and they'll be able to narrow it down that this is the cause of your low blood pressure, then a treatment can be planned or fashioned out for you. Sometimes, depending on your diet, they might change your diet, ask you to change your diet. Okay, so they might ask change your diet. So if a provider can treat that cause directly, hypertension will usually get better on its own. For example, hypertension can happen because of an injury or blood loss. Repairing that injury and replacing the lost blood with a blood transfusion will stop hypertension. Okay, if you take medication, there are some medication they might prescribe to you that affect your blood pressure. Your healthcare provider may change those medications. So if it is a medication-related causes why you are experiencing low blood pressure, then they might recommend to change the medication. Okay. So if the causes remain a mystery, it's also possible to treat it directly. However, curing hypertension is only possible if there is an underlying cause. Without a doctor knowing the underlying cause, it's very, very difficult to find why you are having a low blood pressure. Okay. So, as I said, I wanted to make this a brief video with my little time I have at work. So I decided to just rush in just to make this video about low blood pressure. So please, as I said, continue to subscribe to my page. If you have not subscribed to my page, please do so. Subscribe to my page. Okay. And then do not forget to subscribe. Do not forget to subscribe, like, and leave me a comment. Okay? Like, comment, share, and subscribe to my page if you have not. All right? If you have not, please do not forget to subscribe to my channel. I'm going to leave you guys now and return back to office and attend to some client waiting for me. I decided to quickly do this video so that you guys have something to watch and learn from. Please let me know what you guys think about this topic, low blood pressure. And if you have any question, please do not forget to ask any question that you might have. Right? If you have any question, do not forget to send me your question and I'm going to respond. Okay? Once again, I love you guys. Thank you for watching. And I'm going to see you guys this weekend for another broadcast. Stay blessed and goodbye.